a guy, he actually was a postdoc at Stanford, worked for a guy named Steve Quake, and then separately on his own, went off and started his own laboratory in China and stood up at a meeting a few years ago and said he had done CRISPR in human babies. This has been done. He mutated the HIV receptor, which everyone thinks, okay, that was designed to prevent these babies from getting HIV. It turns out that that mutation is thought to perhaps enhance memory by sort of parallel mechanisms. And then it was very unclear for a short while whether or not this guy was either going to get a Nobel Prize or whether or not they were going to throw him in jail. And so everyone was very tense and waiting in my community, thinking, okay, because when somebody's kind of up for a big discovery like this, everyone kind of circles maybe wanting that maybe they should be involved in getting the accolades. But as the moment that the international community, I think rightfully so, said, this is horrible, you can't do this, there's no ethics committee, you need to think about what you're doing. Everyone was like, I had nothing to do with this guy. I never had anything. And, there was a deep excavation of emails and all sorts of, everyone was like, I got nothing to do with this guy. So it was pretty interesting. Then China said, oh, we're going to punish him. But I'd be willing to bet that his punishment consists of a jail cell that is pretty luxurious with a laboratory. There's no question that CRISPR is going on there. CRISPR is going on in certain other locations on the globe where things aren't as regulated. Because think about the potential payoff for being able to rescue a Huntington's mutation, right? A Huntington's chorea mutation that has somebody at some point in their life, unable to control their arms, hemiballismus of the arms.
What is it?
Huntington's disease. It's a deterioration of the parts of the brain that control motor function. The parts of the brain that control motor function have two main pathways. One is a go pathway, like reach for this coffee mug. And the other one is a no-go pathway, resisting movement. And the no-go pathway degenerates substantially, other things too. And people with Huntington's chorea end up with these writhing ballistic movements. And it's an inherited disease. So you know what gene. It's the Huntington gene. And if you know that your, for instance, parent has it, you can get tested for it because it's late onset. So you can be normal a certain portion of your life and then get it. It's a tragic disease. But if you test positive for this gene, you know you're going to get Huntington's. In which case, with CRISPR, you could just put the gene back in and rescue function. So in any case, CRISPR, gene manipulation of the sort that this guy did in this laboratory in China, again, I think an ethics committee needs to tell the world or decide for the world what people should be allowed to do and not do. But you can imagine for something like Huntington's, it would be tremendously advantageous. Like if you had a child who you knew was someday going to get Huntington's, you'd want to do a CRISPR mutation and put the healthy gene back.